So, what are we talking about today?
Popping pills.
About the various diabetes drugs, I would imagine, then, right?
There's lots of them. There's
Yeah.
even more than, this year than ever before.
Because I think people have known about some that have been out there for a long time, right? Metformin, right?
Well, the first ones were in the 50s, 1950s. And that's when they were developing a new antibiotic, a sulfa drug, and the rats all had low blood sugar. So then they said, well, this will be good for diabetes. They really didn't know how it worked or anything. They just made it up. Oronase was the first one way back then. It's not used anymore now. Oronase, tolinase, diabenase were the first sulfonylureas, and that's where the word sulfa comes from. If you have a sulfa allergy, you can probably still take those drugs, but you have to watch out.
That's one of the things they used to ask you all the time in the doctor's office, if you're allergic to those.
But most people are not allergic to them. A lot more people are allergic to the antibiotic. So just because it has sulfa in the name doesn't mean you have to be allergic to it.
How important was it to have, though, in the oral discovery of those drugs? Because before, was it only injections?
It was only insulin. And the problem with insulin, you take a lot of insulin, you gain more weight. It doesn't really control diabetes well in type 2, so there really needed to be something else for type 2s. And these drugs make you make your own insulin, usually at the right time. It just helps the pancreas make more insulin. And if your pancreas is wearing out, that's the time that these drugs are used. The trouble is, nothing really helped the insulin resistance until metformin came out here. Now, they tried fenformin in the 60s. In Europe, of course, approved metformin in the 60s. We didn't. So we picked the wrong one, and it led to a lot of problems, and they took it off the market. So
was that the whole fen thing? Or
no, that's fenformin is it just caused lactic acidosis, and a lot of people were genetically prone to lactic acidosis. Metformin is not like that as much, and that danger is sort of subsided as far as worrying about it. So the main thing with metformin is you have kidney problems, then metformin will accumulate in your body, and then it may make you sicker. So we try to limit the use of it or lower the dose as the kidneys start failing. Some people think it causes kidneys to fail, but it doesn't. It's just that if you have kidney problems, you shouldn't take the full dose, and there's a certain point where you shouldn't take it at all. So that's the thing with metformin. We've had metformin here. It had to be brought in specially because the patent had already expired. So the company that brought it in, which Bristol Myers brought it in under glucophage.
Oh, yeah, I remember that.
Yeah. They had exclusive marketing for that drug for 5 years. And so it was a big blockbuster for them because it was the first one that ever treated insulin resistance, which is the genetic problem underlying type 2 diabetes. So it did very well. It's still doing very, very well. It's mentioned as the first one you should use even in pre-diabetes. So it's done very well. So
but since then there have been others, right?
Other
types, or still the same type of a drug?
Well, nothing's like metformin. They have a lot of generics now that cause stomach pain more than the brand did, of course, but you sort of have to endure that. And there's brand name, different kinds of metformins that are coated that don't bother your stomach as much. So for people that have stomach problems, there's other versions of metformin. Metformin's also in combination drugs. But the next group of drugs after metformin didn't happen until the late 1990s, and that was Actos and Avandia. And they help insulin resistance also. The problem with them was that they did not help with weight gain. They made you gain weight sometimes. Fluid weight, abdominal fat, things you didn't really want.
Right.
So they weren't as popular, although they helped insulin resistance a lot. And that's what you need in type 2. The problem with them also was that there was fears about heart disease and heart failure and things like that, and so people stopped using them. And I think now they've been exonerated. They cause fluid retention, and so if you have heart problems and you can't pump the fluid out, then you shouldn't use them. And so that's the warning. They don't cause heart attacks like it was feared before.
Were they, if you took a diuretic along with it, was it still effective?
Yeah, it was very good. But I wouldn't use it in anybody that's had heart failure or that has fluid retention problems, so it limits their usage. And now after the scare and all the lawyer ads about Avandia, sort of like, nah. Other people choose something else, especially since there's other stuff. So the other stuff that came out, the other pills, we'll talk about injections later, but the other pills that came out were the DPP-4 inhibitors. And it's sort of hard to explain what they do, but they basically keep your sugar from going up after you eat. So they help GLP-1 stay around longer, which is the hormone that causes the pancreas to work and cover your meals. So that group came. Those are Januvia, Onglyza, Tradjenta, Nicena. There's 4 of them.
Now, are those taken in combination with others, or are those...
Yes, usually they are. Janumet is Januvia plus metformin, and Combiglize is Onglyza plus metformin, and Gento Duetto is Tradjenta and metformin.
Sounds like a chef, Gento Duetto. Or an opera singer.
Anyway, there's mixtures with metformin. Almost all the drugs have mixtures with metformin now. But those are real early in diabetes, and I think if you want to pick the best one, we'll talk about another group that just came out, but if you want to pick the best one for you, it depends on what stage of diabetes you're in. How long have you had diabetes? Is your pancreas still working? Because some of these, like Januvia group, need to be used really early in diabetes, because they're not going to be real effective once you don't make this GLP-1, or once you don't make insulin. Some of them are not as effective. Metformin's always effective. You should always stay on metformin because it helps insulin resistance, which is the genetic defect.
Well, as a doctor, can you figure out the nuance between these drugs of which one's going to be right for the patient by just the numbers that the patient produces? Or?
Well, usually if you come in really high blood sugar, you want to be on something like the sulfonylureas, which lower your blood sugar quickly, like in a day. So, fool around. Because if your blood sugar stays high, it wears out your pancreas faster. So you don't really want to wear out your pancreas. You want it to be working your whole life. And that's what the idea is. The earlier you start medication for diabetes or pre-diabetes, the longer your pancreas lives. At least that's the theory for now. So if your sugar is really, really high, you may want to start metformin and Amaryl or glimepiride, which is one of the sulfonylureas. You may want to start that to get it down, and then as you stay on your diet and lose weight and do all the things that I tell you to do, then you can get off the glimepiride, the sulfonylurea, and just stay on the metformin. And that's better because anything that makes you make insulin or gives you insulin, it tends to make you hungry. So we'd rather you not be hungry if you have diabetes. Januvia in that group would be better used early if your sugar goes up after eating. And most people don't check their sugar after eating because they don't want to know how high it is. But most people's sugar does go up after they eat. And so Januvia and metformin seem a logical choice, especially if people have swings in their blood sugar, like goes up, then goes down, up and down. The metformin may or may not help that. It mostly helps all insulin work better, so if the insulin's made at the wrong time, then you need another one to help out.
So something like A1C won't really tell that whole story, will it?
It doesn't tell a whole story, because if you wake up and your sugar's 90, you think you're doing good. But then your A1C comes back 8, which is high, and you go, what's wrong? And
anything above 7, right? Or is it?
Yeah, 7 or 6.5. Different people have different goals. You get to 7 first, then you can get to 6.5 later. But the earlier you treat the diabetes, since it is a genetic problem and you're wearing out your pancreas, you really do need to be on medication. And most people think, well, can I get off this if I lose weight? Well, unlikely, since it's a genetic defect. But, I mean, there are people that lower the amount of medicine they're taking.
All right, on the talk station, FM 107 and AM 1240, and we're with Dr. K. Jean Lucas from Diabetes and Endocrinology Consultants, online at beachdoctor.com, and we're talking about diabetes medicines, in particular the pills that are out there, and you had, and also injectables, right? There's been, I know in the last decade or so, new classes of those.
Oh yeah, we'll talk about that next time, because they need a whole show.
Okay, they need a whole show of their own.
Because they're real good. But anyway, if people that don't like to take shots, the last group of pills I'm going to mention is the SGL2 inhibitors, which nobody knows what that is, but it makes the kidney not hold on to sugar. Kidneys normally hold on to all the good things and get rid of all the bad things, so they hold on to sugar and protein. And if you could block them from holding on to sugar and just lose that sugar out of your body permanently, that would help with your diabetes. It also would siphon calories out of your body. So that's the group that's on TV now advertising Invocana, Farxiga, and Jardiance are the three, and they've been approved in the past year. So they have a lot of promise.
Do your kidneys also throw off proteins with those two? Or?
No, just the sugar and the fluid. So it does drain fluids out of your body with the sugar. So you want to drink lots of water. You also don't want the sugar to accumulate in your bladder, causing bladder infections and yeast infections. So you want to drink lots of water with them. But they tend to make you lose weight. They tend to make your sugar not go up as high after meals. So they sort of drain sugar when it's the highest. Even if your sugar is normal, it will still keep your kidneys from holding on to sugar. So that helps overall.
Okay.
You have less side effects, of course, if your sugar's lower when you start them because you have less sugar, in your bladder. But those are very promising, and they're mixed with metformin as well.
Now, are those also sometimes prescribed for weight loss, or are they not?
Not yet.
Not yet. Not yet. Yeah. But I mean, if somebody's not diabetic, do they have an adverse effect?
No.
Okay. All right, again, if you want to find out more about your diabetes or you want to get under that care or learn more about some of the tests as well, as they come up, you can go on the website at beachdoctor.com.